Now here, experts have warned that the NHS is struggling to get firing on all cylinders. A new report by the Institute for Public Policy Research suggests that low productivity and poor staff retention are dampening the health services performance. So let's get a view on this. I'm joined now by Dr. Rida Khan, who's a junior doctor at Epsom and St Helier Hospital. So very good morning to you. Thanks so much for coming in.
No, thank you for having me. Good morning.
So they are talking, this think tank, about a twin crisis, aren't they, of poor staff retention and low productivity. Does that ring true to you?
Yeah, I do understand where they're coming from. I think productivity is really important at the moment. They are seeing, the report does say that there's low productivity in the NHS, but I think there's lots of factors that attribute to that. Some of that is the budget that we have, and also a lot of it is the staff retention, and we have a lot of high turnover. What we need to do is we need to make sure that our bright, brilliant minds stay in the NHS and that we really value our medical talent that we have. We invest a lot of our resources, time and money on a lot of our healthcare professionals, and they're not feeling happy and fulfilled in their professions, which is making them seek opportunities outside of the NHS. Either they're trying to leave medicine or move to other countries.
Yeah, give us more of an idea of why they're doing that. If you've got colleagues who've left, what are their reasons for going?
I think there are lots of colleagues who are planning to leave or are looking to leave. A lot of them are looking to leave medicine as a whole or just moving to other countries where there is a better work-life balance. I think a lot of it is being overworked. A lot of people do feel overworked, and that is with the staff numbers that we have. We need to make sure that we are well staffed, and if we have the experience is key. Experience is very precious, and we have senior doctors that have a lot of experience, and when we want to keep them and retain them in the NHS, we want continuity of care. We build a rapport with our patients, and they like seeing a familiar face, they like to be cared for by the same doctor. But if we have doctors turning over, we have this high turnover, that will affect patient care. What we need to do is make them feel happy and fulfilled in their jobs, and what we can do by that, make sure staffing level is at a good number, because when we have good staffing levels, it reduces the workload on the colleagues. When there's a huge workload, you're prone to more burnout, you're overworked, you're stressed, and you're not feeling very fulfilled in your job, and that's when you seek other opportunities.
Yeah, and you talked about resources and the budget.
Yeah.
Although this think tank does suggest that money's not necessarily the answer, because they talk about more money for the service not leading to many more patients being treated overall, and at the same time workers calling it quits. So would you accept that it's not just about the cash?
I think when it comes to the cash, I think NHS pay, for example, should be competitive, because that will be a big aspect in keeping people in the NHS. I also think with staff wages, what they're trying to do with the budget is they're trying to fund in more technology, which will be beneficial. If we have better computer systems, that makes us work more efficiently. Some hospitals still use paper notes. So I think if we all go digital, that will be a very, very beneficial for care as well. And also what we need, we are thinking of having more surgical hubs and working on getting more surgical hubs that will help with elective surgeries and cut down the waiting time, and more patients will be able to get elective surgery. So that's where the money in the budget is meant to be going, in the capital budget. But I think also the daily running, and also a lot of people that are making these decisions are not senior clinicians that work on the front line. So there is a disconnect of the people making these big decisions in trying to run this smoothly. So if we have more of senior clinicians who are usually on the shop floor and are working alongside colleagues and patients and resident doctors, they can provide a lot of information and also give more guidance of how we can improve.
Well, yeah, I mean, this report talks about a lack of a staff voice, the suggestion that decisions are made at a top level that don't necessarily take into account the experience, the lived experience of doctors.
Exactly.
On the hospital corridors. Do you think that's right?
I think that is true. I think the people that are making decisions aren't the ones on the front line. So I think we need to be included, especially senior doctors and senior clinicians who have a wealth of experience, understand the pressures that are happening at the moment, and then how we can combat that. And that would be very helpful as well. And I also think that listening to them then we will exactly know what the burdens are, and what we need to make sure is that we prevent burnout, we prevent stress that a lot of clinicians do experience, and that does affect a lot of the staffing as well, because when people are moving, we have low number of staff then, and especially the experienced staff. So sometimes it takes a while for new doctors to come in, to get used to a hospital, to get used to how everything runs. So that's where we cannot afford to have a brain drain.
Have you felt close to burnout at times?
At times it can get busy, but I have to say that what we can do, and the pressure can be high, they can be at times, but I think we are stepping in the right direction at the moment with the new pay that's been accepted, and they're going to be looking into our rotas, so it shouldn't be as relentless that they are as the moment. Exception reporting is when we are spending time overworking, that will be looked into. So I think we are headed in the right direction with the new government, and hopefully this will relieve a lot of pressure that resident doctors are facing.
Oh, we really appreciate you coming in and talking to us about your experience and the experience of some of your colleagues as well. Rida Khan, thanks very much indeed.
Thank you. Thank you.